Assalamu alaikum. Hello, it's OFP. Likely to discuss about neural tube defect. What is neural tube defect? In neural tube defect, there is failure of the neural tube to close. Failure of the neural tube to close by fourth week of development. Failure of the neural tube to close by fourth week of development. Why it happened? It happened due to maternal folate deficiency during pregnancy. How diagnosed by ultrasound, maternal serum, alpha fetoprotein. By these two tools, you can diagnose NTD. Now, spinal dysraphism and cranial dysraphism. What is spinal? In spinal dysraphism, there is spina bifida occulta. Occulta In occulta, it is closed neural tube defect, but the rest, meningocele, myelomeningocele, and myeloschisis, there is open neural tube defect. In spina bifida occulta, failure of the caudal neural tube to close, but there is no herniation. Dura is intact, usually seen at the lower vertebral level, associated with tuft of hair or skin dimple at the level of bony defect. What is meningocele? If meninges herniate through the defect, if meninges herniates through the bony defect, it is called meningocele. If meninges and spinal cord, that means neural tissue herniate through the bony defect, it is called myelomeningocele. If only neural tissue, exposed and fused neural tissue, but without meningeal covering, no meninges present, that is myeloschisis. So in spinal dysraphism, what we are getting in spina bifida occulta, there is no herniation, there is no there is closed neural tube defect. There is closed neural tube defect. In here, dura is intact, usually seen in the lower vertebral level, associated with this is spina bifida occulta. There is tuft of hair or skin dimple is present. Tuft of hair and skin dimple is present. In meningocele, the meninges herniation of the meninges through bony defect. Herniation of the meninges through bony defect. There is open neural tube defect. There is open neural tube defect. And in myelomeningocele, there is herniation of the neural tube defect, herniation of the neural tube as well as spinal tissue, uh, as well as neural tissue or spinal tissue. And in myeloschisis, there is unfused neural tissue. In cranial dysraphism, there is anencephaly. In anencephaly, there is open neural tube defect. There is failure of the rostral neuroport to close. If there is failure of the caudal neuroport to close, this is spina bifida occulta and rostral neuroport to close. It is called anencephaly. In anencephaly, there is no brain, no forebrain, open calvarium, often presents with polyhydramnios. There is more and more amniotic fluid in the mother. This is all about neural tube defect. Now, two sort of a brain malformation, holoprosencephaly and lesencephaly. In holoprosencephaly, failure of the forebrain to divide hollow. In holoprosencephaly, we have to remember the forebrain, failure of the forebrain to divide into two cerebral hemisphere. Failure of the failure of failure of the what forebrain to divide into two cerebral hemisphere. This is developmental field defect, usually happens in third to fourth weeks of development, associated with SHH mutation, may be seen in Patau syndrome. So Patau forebrain fetal alcohol, Patau forebrain fetal alcohol. Presence with midline defect, monoventricle, there is single ventricle and fused basal ganglia. There is cleft palate, hypertelorism, and cyclopia. There is proboscis and increased risk of pituitary dysfunction like diabetes insipidus. So problem in the forebrain. Forebrain fails to divide into two cerebral hemisphere. There is association with fetal alcohol and tau. There is monoventricle fused basal ganglia, cleft palate, hypertelorism, cyclopia, and there is diabetes insipidus. And in lesioncephaly, there is failure of the neuronal migration. There is smooth brain and lazy smooth brain, lack of sulci and chide. There is dysphagia, seizure, microcephaly. Also seen microcephaly seen in Zika virus and facial anomalies. And that's all about neural tube defect and brain malformation. Hope you enjoyed.